Through various agreements, the Pharmacare Act did pass last fall, but it has appeared to stall, despite the federal government setting aside $1.5 billion for funding. The bill includes a call for government to cover the costs of contraceptives and diabetes medication, while studying the best way to eventually cover all medications. The federal government has indicated it will move forward on deals it previously signed with BC, PEI, Yukon, and Manitoba. But there is no sign on the fate of the remaining provinces and territories. So joining us this morning to look at where the program stands as of now is Dr. Amanda Black, past president of the Society of Obstetricians and Gynecologists. Welcome, Dr. Black.
Thank you for having me.
For people who might not have been following as closely as someone as yourself, where is the Pharmacare plan sitting at right now?
Well, as you mentioned, the National Pharmacare Act received royal assent in October 2024, and it basically established a framework for a national, universal, single-payer pharmacare program, and it was to begin with contraception and diabetes medication, and then look at other essential medicines. And in Canada, as we know, healthcare tends to be a provincial responsibility. So this required signing of bilateral agreements with the provinces. And before the last federal election, only 4 provinces and territories, so BC, Manitoba, PEI, and the Yukon, had signed these bilateral agreements. Now, the Liberal government, was part of their election platform, had pledged to uphold Pharmacare, but at this point we haven't seen any further bilateral agreements signed with any of the provinces or territories. So our concern, obviously, is that the promise of equitable reproductive health care, specifically across Canada, is at risk of becoming a regional privilege instead of a national right.
And your concern is also based in the fact that we have seen consistently the Liberal government, under its new leadership with Mark Carney, has started to move things back onto the provincial plate, right? The federal government got really involved in healthcare, pharmacare during COVID and on, but now starting to shift things back to the provinces. So what is your concern about the remaining provinces and territories then?
Our concern is that we want to make sure that everybody in Canada, regardless of your income or your postal code, has access to healthcare and reproductive services, particularly contraception, of course, the diabetes medication. We consider these essential medicines, and investing in this and investing in the healthcare of Canadians is good economic policy for the government. Last week, we published research in the British Medical Journal that looked at the effect of a free contraception program that had been established in BC in April 2023. And not surprisingly, we found that cost matters. When British Columbia began covering the cost of prescription birth control, more people used contraceptives, and importantly, they chose the more effective methods of contraception. So this is something that ultimately can result in a cost savings for the governments. We know from previous research the direct cost of an unintended pregnancy for Canada as a whole is at least $320 million. We know from cost modeling that was done in BC that that when you start covering the cost of contraception, that you reach cost neutrality at year 2, and by year 4, you're saving $27 million a year. So that's a savings of $5 per every resident in BC, and that's money that can be reinvested into the healthcare system or other programs that the governments want to look at.
Dr. Black, what are you hearing from patients?
Well, certainly as a healthcare provider, we see that there are a lot of disparities when it comes to coverage. There's a common misconception in Canada that everybody already has some type of coverage or insurance plan that covers their medications, and that simply isn't the case. We have a bit of a patchwork system of coverage in Canada, and we know that a lot of patients, even when they do have coverage, it doesn't cover 100% of their medications. So as a healthcare provider, what we'll see in the offices are people who are coming in and they might not be able to afford their most effective method of contraception or the one that they choose because they don't have coverage for that, or the upfront cost of it is $450 a year for some of the most effective methods of contraception. They simply can't afford that. The downside is that they don't use that. They have an unintended pregnancy, and then we have all of the implications that has for the individual, their family, and society as a whole. So we want to ensure that people are able to plan their families without finances being a barrier to its use, and then avoid unintended pregnancies and the consequences associated with those.
Dr. Amanda Black, thanks so much for being here this morning. We should let our viewers know we did reach out to the Health Minister's office for a statement, and we did not hear back in time for this interview.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.